Hello dear students, this is Mushtaq from MC Society Institute of Pharmacy Azam campus. Today we are going to learn about anti-asthmatic agent and bronchodilators. Outcomes of today's lecture. The student will be able to define the term bronchial asthma. The student will be able to explain the forms, types and treatment of asthma. The student will be able to define and classify the anti-asthmatic and bronchodilator drugs. The students will be able to explain the status, asthmaticus, causes, symptoms and treatment of it. First, coming to bronchial asthma. Bronchial asthma is a clinical syndrome characterized by proximal dyspnea and wheeze due to increase in airway resistance in narrowed bronchi. The narrowing of bronchi is due to bronchospasm and edema of bronchial mucosa. Because of this, the patient may feel difficulty in breathing and may have breathlessness. So we'll see animation of bronchial asthma.
Asthma, or reactive airway disease, is a chronic disorder that results in restricted breathing due to inflammation of the bronchial tubes, the main air passages in the lungs. Asthma affects 3 to 5% of adults and 7 to 10% of children in the United States. Severe asthma attacks cause approximately 5,000 deaths per year. 3 changes occur inside the airways of the lungs in people with asthma. The first change is inflammation or swelling, whereby the airway becomes inflamed and produce a thick mucus. Inflammation then leads to constriction of the muscles around the airways, causing the airways to become narrow. This narrowing is also referred to as bronchospasm. The third change is increased sensitivity of the airways, causing the asthma patient to become overly sensitive to animal dander, pollen, cold air, and tobacco smoke, to name a few. Asthma patients need to work together with their doctors to develop a medication action plan to control symptoms and minimize attacks.
The asthmatic patient have continuous hyperreactivity of the bronchia which constricts due to allergens, physical and chemical irritants, infections, psychological factors and hereditary factors. Because of all these reasons, the bronchi will get constricted. In bronchial asthma, there will be airway inflammation, episodic reversible bronchospasm, chronic inflammation that leads to marked bronchial hyperactivity. So these allergens will cause us the bronchial obstruction by increasing the bronchial secretion, inflammation, which leads to narrowing of airways. There will be release of cellular mediators from IgE sensitized mast cells and other cells involved in immunological responses, and the mediators include leukotrienes, chemoattractants, cytokines and enzymes. Next, asthma will be of two types, extrinsic and intrinsic. Extrinsic asthma may be considered when is associated with family history of allergies and usually attains episodic form. In intrinsic bronchial asthma, there is no family history of allergy and asthma is of chronic form. The bronchial asthma leads to hypoxemia, that is decrease in arterial oxygen tension, and hypercapnia, that is increased arterial carbon dioxide tension. The prolonged hypoxemia causes right ventricular failure and hypercapnia causes cerebral vasodilation, mental confusion, drowsiness and finally coma and death. Next, coming to the types of asthmas. First type is episodic form. Here the patient get acute attack of asthma which is rapidly and completely relieved by bronchodilators with no disability in between the attacks. Next is chronic form, where there is a persistent dyspnea, difficulty in breathing, and whizzing sound with in between acute attacks occurring from time to time. Next is status asthmaticus. Here, an acute attack is severe, persistent, and does not respond to bronchodilators, so which leads to respiratory failure or insufficiency, and it is an medical emergency. Next, exercise induced asthma. Here, the attack occurs due to physical exercise and activities. Next, treatment of bronchial asthma. The therapy of bronchial asthma includes elimination of trigger factors like allergens, etc., avoiding respiratory irritants such as tobacco, smoke, chemicals, etc., psychological treatment, drug therapy like bronchodilators, antibiotics, corticosteroids, and supportive measures. The treatment of acute attack, that is called rescue drugs. Examples are beta adrenergic receptor agonist are the rescue drugs which relieves the bronchospasm, causes bronchodilation. Next, strategies of asthma therapy. Acute asthma attack promptly and effectively treated with beta 2 agonist, muscarinic antagonist, or theophylline and its derivatives. Chronic asthma requires long-term preventive treatment, and usually the inflammation in the airways can be treated by corticosteroids. Next, coming to the anti-asthmatic agents. Definition: the agents which are used in the treatment of asthma are called as anti-asthmatic agents. There are two types: bronchodilators and anti-inflammatory drugs. The bronchodilators are the agents which causes bronchodilation and prevents and relieves the symptoms of asthma. Normally, they will dilate the bronchioles and produces bronchodilation. Examples of bronchodilators are classification of bronchodilators. First is symptomatic amines, drugs which act on alpha and beta receptors like adrenaline, drugs which acts on beta and beta 2 receptors like isoprenaline, ocrepinolone, and drugs which selectively acts on beta 2 receptors like salbutamol and terbutaline. Next, anticholinergic drugs like ipratropium bromide, tiotropium bromide, etc. Next, phosphodiesterase inhibitors or theophylline, aminophylline, etc. All these agents, what they will do, they will dilate the bronchial. Next, classification of anti-inflammatory drugs. Because in asthma there is a severe inflammation and increases in secretions that can be reduced by using anti-inflammatory drugs. First class is corticosteroids. Systemic examples are hydrocortisone, prednisolone, and inhalations are beclomethasone, dipropionate, budesonide, fluticasone propionate, etc. And second class is leukotriene antagonist like montelukast, zafirlukast. And the last, mass stabilizers like sodium chromoglycate and ketotifen. So all these agents will reduce the inflammation and relieve from the symptoms of asthma. And the next is status asthmaticus. Already we have learned that status asthmaticus is a severe prolonged paroxysm of bronchial asthma that does not respond to the bronchodilator therapy. The patient is markedly dyspneic, means he feels very difficulty in breathing, exhausted and dehydrated. Since it is a medical emergency, the patient should be hospitalized and treated promptly. The causes of status asthmaticus is an acute respiratory infection, abrupt cessation of glucocorticoid therapy. If you stop the glucocorticoids, the inflammation will get increased and there will be attack of status asthmaticus. Use of drugs like aspirin and non-steroidal anti-inflammatory drugs, inhaled allergens, or acute emotional stress. All these may lead to status asthmaticus. Symptoms: of status asthmaticus is dyspnea, difficulty in breathing. The patient will be exhausted, cyanized, and dehydrated, and sometimes the patient may have tachycardia, that is increase in heartbeats. The life threatening symptoms in status asthmaticus is silent chest, feeble respiratory efforts, cyanosis, bradycardia, that is decreased in heart rate, hypotension, exhaustion, confusion, and coma. So these symptoms appears, that means the patient should be treated promptly and hospitalized to save their life. Next, treatment of status asthmaticus. First, patient should be hospitalized. Second, they should be given life-saving drug, that is hydrocortisone hemisuccinate intravenously at a dose of 100 to 200 mg as initial dose and repeated every 1 to 2 hours. Simultaneously, we should give nebulized ipratropium and salbutamol repeatedly. If we can also administer aminophylline IV with normal saline. If the patient is restless, we should give diazepam 10 mg intramuscularly. If the attack is controlled, the corticosteroids are given orally with tapering dose, that is, we will reduce the dose gradually within 12 to 15 days. If there is hypoxemia, we should administer oxygen. If infection is there, we should give antibiotics. If there is acute respiratory failure, the patient should be given artificial positive pressure respiration. If the patient is dehydrated, we can give rehydration therapy with plenty of fluids orally or by IV infusion. If there is acidosis, we should give sodium bicarbonate IV. So this is a treatment of status asthmaticus. What we have learned today, we have learned about asthma, which is a chronic dyspnea and wheeze due to narrowing of airways and resistance to airflow. We have seen two types of asthma, like extrinsic and intrinsic, and the asthma has been classified into episodic form, acute asthma, chronic asthma, status asthmaticus, and drug exercise induced asthma. Next, we have learned about antiasthmatic drugs which are used in the treatment of asthma, and two types of antiasthmatic drugs are there, that is bronchodilators and anti-inflammatory agents. And the last, we have learned about the symptoms and treatment of status asthmaticus. Thank you.